Welcome to the webinar series, Introduction to Curriculum Development and Medical Education Scholarship for Resident Trainees. This is Webinar 1. This webinar will cover an Introduction to Curriculum Development and Medical Education, a 6-step approach by David Kern, Kern Steps 1 and 2, Problem Identification and Needs Assessments, and Preparation for Kern Step 6, Evaluation and Feedback. The goal of Webinar 1 is that learners will be introduced to the Kern 6 steps of curriculum development for medical education and understand the first 2 steps of curriculum development, the purposes of problem identification and needs assessments, and be aware of common frameworks for evaluation in medical education. The objectives for Webinar 1 are that by the end of this webinar, learners will be able to, number 1, identify a problem for a curriculum to address, number 2, contrast general needs assessment and targeted needs assessments, number 3, name the finer criteria for evaluating a scholarly question, and number 4, describe Miller's Pyramid for Clinical Competence and the Kirkpatrick Model of Program Evaluation as frameworks for evaluation in medical education. Pause the webinar for a moment and think to yourself, what is a curriculum? What do we mean when we say curriculum? Write down a few ideas to yourself, then continue on the webinar. A curriculum is defined as a structured, ordered plan of generalizable or standardizable experiences imparted to an individual or group in order to convey and disseminate knowledge, with a concrete set of learning objectives to achieve in relation to the overall goal of skills acquisition. A curriculum can be further described in several different ways. First of all, a curriculum is a planned educational experience. It can be one individual or a set of courses, and can include one individual learner or a group of learners. A curriculum is offered by a school or educational institution. Curricula are frequently influenced by external guidelines from specific societies or professional groups. And finally, a curriculum is meant to address the desired or expected outcomes put forth by that institution. Pause the webinar again and think to yourself, if that is how we define a curriculum, then what is evaluation? Evaluation asks the question of, did the curriculum work? Did it achieve the desired outcomes? How well were the objectives put forth by the curriculum achieved? Evaluation is both of the individual learners, for example, did my student pass the test, as well as the program or the curriculum itself, for example, were the objectives of the curriculum achieved? Evaluation can be formative or summative. Formative evaluation refers to evaluation that is used to form future practice, such as a midterm examination. A summative evaluation happens at the end of a curriculum, such as the final examination. Evaluation may involve a comparison to a gold standard of performance. And finally, evaluation helps to inform ongoing curricular changes and how to modify the curriculum moving forward. These are the 6 steps of curriculum development as described by David Kern in his book, Curriculum Development for Medical Education, a 6-step approach. A large portion of material covered in the webinar series will consist of these 6 steps and serve as the framework that we will encourage you to use when you plan your individual projects. Please also refer to the Kern text for additional reference as you complete the webinars. The majority of the webinar today will cover Kern Steps 1 and 2, Problem Identification and General Needs Assessment, and Needs Assessment of Targeted Learners. The remaining 4 steps will be covered in upcoming webinars in the series. The first step in Kern is Problem Identification and General Needs Assessment. This begins with identifying and characterizing the problem in medical education that you want a curriculum to address. What is the problem and who does it affect? Where are the problems or deficits? These problems and deficits are often characterized as knowledge, attitudes, or skills. For example, a deficit in knowledge may be stated as, residents have diminished knowledge about X topic. Or a deficit in attitudes could be characterized as, residents don't rate Y topic as important to their education. Or finally, a problem with skills may be stated as, residents can't perform Z skill adequately. Defining a problem in specific terms is crucial in setting the basic foundation for the rest of your curriculum. Once a problem is identified and characterized, the next step is performing a general needs assessment. A general needs assessment is meant to compare the current approach to the ideal approach. In a perfect world, how would you address this problem? In some cases, the ideal approach may be the approach you are considering using with your new curriculum to address the problem. Like any scholarly project, the first step in a general needs assessment is to review the information that is available via a thorough literature review. Who else is working on your problem and how? What methods are they using? What has or has not been studied before? Think broadly at this step. Consider looking not only within your own specialty, but also in other specialties. or even outside of literature specific to physicians, for example, nursing or psychology literature. Look to the governing bodies in your specialty to determine what the priorities are for those groups, and do research on who the experts are in the problem area and what is being done elsewhere. After doing a thorough review of the literature available that is relevant to your problem, a general needs assessment also requires consideration of all the stakeholders involved in your problems. It's easy to think of the learners, the residents or students who will receive a curriculum, but think about the other people that the problem affects: patients, other healthcare providers, medical educators, society in general. The needs of other stakeholders may help frame aspects of your curriculum in the future. Now we move on to the second step in Kern, the targeted needs assessment. The targeted needs assessment refers to specifically targeting the learners, the people that your curriculum will address. In a targeted needs assessment, we discuss what is going on with the problem that has been identified for that very specific group of learners, and the difference between the ideal and the actual approaches in their experience. This is where you can obtain the same kind of information we discussed in the general needs assessment, but again, it is very specific to the targeted learners and limited other stakeholders specific to them and their environment, for example, program directors for a residency program. Often the additional information needed for a targeted needs assessment requires collection, and here is a frequent opportunity for a scholarly project. A well-organized and thought-out targeted needs assessment can often stand alone as scholarship, particularly if the problem is understudied or rather novel. There are several different methods to conduct a targeted needs assessment. These methods include informal discussion with the learners of interest, interviews or focus groups, surveys of the learners, directly observing individuals, or performance audits of the learner's current practice. When selecting a method, it is very important to consider practical aspects of each of these methods that may affect how easily you are able to conduct them. You must be able to get the time and access to the targeted learners and stakeholders to conduct a targeted needs assessment, as well as resources and expertise such as space, recording devices, access to questionnaires or surveys, or expertise involved in designing a survey or analyzing results. To recap the first section of Webinar 1, we have gone through a brief discussion of Kern's 6 steps of curriculum development, the framework that we will be using for the remainder of the webinar series. We have discussed the first 2 steps of Kern, which include identifying the problem in medical education that you wish to address, and conducting both general and targeted needs assessments. We have compared and contrasted general and targeted needs assessments, and discussed common methods for collecting information for a targeted needs assessment. Here we are going to do a short exercise in applying the first 2 steps that we have covered in Kern. Betty is a second-year resident. She has enjoyed residency very much so far, but has found herself wishing that she knew better how to talk to family members at night when she is the night float resident and they are expecting an update on their family members. Betty feels perfectly comfortable updating families and patients during the day when they are her patients, but wishes at some point someone would have taught her how to communicate with family members as a covering doctor. Betty asks some co-residents, and they don't remember anyone ever teaching this to them either. She wonders if there's some way she can bring some attention to this topic in her residency program. Please turn to your Part 1 discussion sheet and pause the webinar after listening to these instructions. Please reflect on the following questions. How can you define Betty's problems? Where are the deficits in her learners? Knowledge, attitudes, skills? What would her general needs assessment entail? Her targeted needs assessment? Pause the webinar to complete these sections on your discussion sheet. When you have completed these exercises, please continue in Webinar 1 for the next section. Now that we've discussed the first 2 steps of Kern, we are going to jump forward a bit to preview the last step, evaluation and feedback. Though this is technically the last step of Kern, it is worth introducing some principles early in the planning portions of the project to gain familiarity with some of the terms. This step will be revisited in much greater detail in Webinar 6. We've discussed in Kern Steps 1 and 2 how to identify the problem your curriculum hopes to address and how to lay the groundwork for planning your curriculum by performing general and targeted needs assessments. When we begin to consider eventual evaluation of the curriculum, however, we must now look at the problem and the curriculum through the lens of future potential scholarship, meaning presentation, dissemination, and publication of your work. Here we want to define not only the problem the curriculum addresses, but also the scholarly question, and judge its applicability to a set of well-known criteria for a good research question, the FINER criteria. FINER stands for feasible, interesting, novel, ethical, and relevant. Is the project feasible? Do you have the adequate time, funding, mentorship, and expertise to work on this project? Can the project be done within the time frame that you have? Is the project interesting? Are you passionate about it? Is it interesting to others in your field? Is it interesting to the governing bodies and other organizations who you have identified as stakeholders for your project? Is the project novel? Has it been studied before? Is it an underdeveloped area of medical education? Are you applying an innovative method to the project? Is the project ethical? Does it need IRB approval? Are there vulnerable populations? Remember, most students and trainees are considered vulnerable populations because there is always the concern for coercion for participation. And finally, is the project relevant to your field or to medical education? Is it timely to recent changes or policies? Is it considered important or priority by your institution or governing bodies or organizations? Using the finer criteria can help you look critically at your research question and consider what areas may need to be refined or reworked before you proceed toward planning your evaluation. After you evaluate your research question using the finer criteria, one of the next steps in planning for evaluation is to consider your potential evaluation through common evaluation frameworks in medical education. These frameworks can help in conceptualizing the outcomes that you wish to measure in your curriculum. The two frameworks that we will be introducing are the Miller's Pyramid for Clinical Competence and the Kirkpatrick Model for Training Program Evaluation. The first evaluation framework is Miller's Pyramid for Clinical Competence for the Individual Learner. Consider a broad example of a curriculum, such as CPR training. Consider one learner who is undergoing your curriculum, and the goal is for the learner to progress up the pyramid. At first, we hope the learner will attain knowledge and therefore know something about the material. For example, information regarding causes of cardiac arrest from a lecture. Next, they would attain competence and therefore know how to apply the knowledge that they have learned. This may be that after the CPR training, the learner could describe the steps of CPR. Next, the learner should be able to demonstrate their performance, that they can show how to use the material presented to them. This may be performance of simulated CPR on a dummy in a training environment. And finally, at the highest level there is action, or DOES, the evaluation of actual clinical practice behaviors, which would demonstrate that the curriculum is effective. This would perhaps be observation of that learner's skills in CPR during an actual cardiac arrest. Evaluation metrics that address performance at the lower two levels of the pyramid are often the easiest to study, but methods that address the higher two levels are often more desirable, though typically more challenging to study. The second evaluation framework is the Kirkpatrick Model of Training Program Evaluation. These two models are related, but in contrast to the Miller's Pyramid, which was assessment of one learner going up the pyramid, this model refers to evaluation of the entire program or curriculum. Consider again the example of CPR training. The bottom level is evaluation of reaction, which is typically satisfaction with the curriculum. Did the learners like the CPR training session? The next level is evaluation of learning. Did knowledge or skills transfer to the learner? Were participants of the CPR training course able to pass the knowledge-based post-test? The third level is evaluation of behavior. Did knowledge transfer to the workplace? If, for example, those learners in the CPR training course subsequently rotated through an ICU rotation, would an audit of their performance indicate that they were all performing chest compressions at the appropriate intervals? And finally, the top level is evaluation of results. Did the curriculum change patient care or have an impact on society? Did the CPR training overall decrease mortality rates in the ICU? The top of Kirkpatrick's model is a very powerful outcome, but very difficult to achieve, as it is often influenced by other factors. Recall again the story of Betty, who identified the problem of a gap in knowledge and overnight communication for unfamiliar patients and family members. Betty is planning on implementing a curriculum to address this gap. She is thinking about ways in which her curriculum may be potentially evaluated in the future. Again, please turn to your Part 1 discussion sheet and pause the webinar after listening to these instructions. Describe an evaluation method for Betty's project for each level of both the Miller and Kirkpatrick models. When you have completed these exercises, please move on in the webinar to the next section. To recap the second section of Webinar 1, we have previewed Kern's Step 6 by introducing the finer criteria for scholarly goals, and we have discussed two of the most commonly used evaluation frameworks in medical education, Miller's Pyramid for Clinical Competence for assessment of the individual learner, and the Kirkpatrick Model for evaluation of a program or curriculum as a whole. After you have reflected on Part 1 and have received feedback on your answers, please think now about your own scholarly project in medical education. What is the problem that you have identified that your project addresses? Where and in whom are the deficits? Knowledge, attitude, skills? How would you approach a general needs assessment for your problem? What general information can you review? What associations or governing bodies may be applicable for your problem? How can you identify experts in the field of your problem? Who are the general stakeholders who should be considered? Who would be the specified learners necessary to speak to for your targeted needs assessment? What kinds of methods might you consider for your targeted needs assessment? Do you have the necessary resources to carry out that targeted needs assessment? Can you apply the finer criteria to your project? Are there areas of finer that you need to refine or consider more carefully? If you have begun thinking about evaluation methods, where would they fall in the Miller and Kirkpatrick models? Please consider how these areas that we have covered in Webinar 1 may apply to your project and review these parts of the webinar if necessary. Using the feedback you have received in Part 1, please complete the Part 2 discussion sheet to answer these questions for your own scholarly project. This concludes Webinar 1 of the series, Introduction to Curriculum Development and Medical Education Scholarship for Resident Trainees. Please continue to Webinar 2.